anyone. I'm not seeing anyone here. So this is Nurse Merit's. I promised us please hold on. I want to see. Okay, yeah. So we have quite a lot on our page today. So I think we're going to just be taking as much as we can. Right. So let's start with the list. The one we have on the list on kidney transplant care. If you can hear me, please let me know. If you okay. If you can hear me, let me know. So we're starting with kidney transplant care. Or should we start with kidney stone, or should we start with high blood pressure management? This is my first time. I guess I should see you people's comments here. I'm not seeing any comments yet. So let's start with kidney transplant care. By now you all know me. My name is Nurse Merit and I'm a nephrology nurse. So nephrology means is a section of a section where you specialize on kidneys. Those that their kidney have failed, dialysis, what to do so that they can, live a life as though they have their kidneys, which dialysis is the next thing. When your kidney fails, dialysis is the next option, and then afterwards you now start talking about transplants. So for the purpose of this live, we're just going to be talking about transplant care, post-transplant care, right? My shirt is big. So post-transplant care, it is very, very important that as you're planning to have your transplant, please, especially for some of us in this part of the world that money is as you're planning for transplant, please plan for your drugs. Those drugs are very, very important. They last you as long as your transplant lasts. Okay, so having known about that fact, as you're getting people that will help you with your transplant money, as you're getting people that will help you with your dialysis, let them know about the drugs, because the drugs are as important as the transplant. Without the drugs, your transplant will fail, and trust me, when it fails, it gets bad. Okay, so it's better it lasts you for some years before it fails. Now I've had this question: how long will a transplanted kidney last? Yes, well, if it is a living donor kidney transplant, like the person that gave you the kidney is alive, okay, and related to you, especially twin, it's going to, please, people that are around, please try to like it's going to last at least 20 to 25 years. It depends on some certain factors. Okay, some certain factors are really, really involved. But if it is from somebody that is already dead, brain dead, it's going to last you somewhat between 10 to 15 years. It depends on the factors. Very, very important. There are so many factors that will ensure this. So factors like if you're taking your drugs well, if you have infection, if you have anything that will put stress on the kidneys, okay, and of course some management we will be talking about. So having known about this, let's get into transplant care proper. Now, those drugs that are given to you, I hope you all know that those drugs are, they can cause diabetes, right? Yeah, they can, because they are immunosuppressants, and because they are immunosuppressants, most of them also increases your blood sugar level, right? So they increase your blood sugar level and they can cause diabetes for you, and you're still back to, the person is still back to square one, where the diabetes can also destroy the kidneys. So what you're going to do is, if you are diabetic already, please make sure you are on strict diabetic, those your anti-diabetic medications. People that are on their insulin, there's no problem. Having kidney transplant doesn't stop your diabetes or doesn't stop your high blood pressure. It's going to be there if you had diabetes or you had high blood pressure before the transplant. So if you had high blood pressure before the transplant, you had diabetes before the transplant, it is still going to be there even after the transplant. So what you need to do is to continue your medication, but make sure they are monitored strictly. However, if you don't have diabetes before your transplant, you are at high risk of developing diabetes. Yeah, especially if someone in your family has diabetes or what or not. So what you need to do is, of course, the first I think first 2 weeks, they're going to prescribe prednisolone for you, right? Prednisolone for you, and some, immunosuppressants that can actually increase your blood pressure, your sugar level. But that first week, they are also going to try to bring your blood pressure, your sugar level down. However, if you go home, please make sure you continue to monitor your sugar level. If at any point it increases to the nearest above the limits, I can see nobody, we are just one here, but no problem. I guess others, they will, I will rebroadcast this, so I'm just talking to one person. I know it's kidney transplant, because some diabetics, some blood pressure people say they will come later after I'm done talking for the transplant people. So just monitor your sugar level, and anytime it's as if it's going high, please just let your doctor know, and your doctor will place you either on insulin or any anti-diabetic drug. Please don't stop, okay? Don't just continue to take this drug, because this drug can increase your chances of having diabetes. And diabetes, of course, you know what it does, can destroy the new kidney that you have right there. So, having known about that diabetes, okay, and your chances of having diabetes and how to manage it, the next thing that is very, very important is, there are some drugs, there are some things that you don't need to take with your drugs. Those drugs that has been prescribed to you. For instance, if you have sacrolimus, everolimus, tacrolimus, those drugs, these three sets of drugs, please, you have to avoid taking it with grapefruit. Okay, don't take these drugs with grapefruit, because grapefruit affects how these drugs absorbed in the kidneys. So please don't take your drugs with grapefruit. Okay, if you also have MMF, you know that MMF, if you have MMF, take MMF by mouth, okay, and on an empty stomach. Either you take it 1 hour before, or you take it 2 hours after your meals, okay. Then we have, please make sure you take those drugs at the exact time, the same time that it's been prescribed. Just find the way. And one of the things that people do is that they tend to allow their drugs to finish before they get another one. Make sure you have this drug at least like um one extra serving. So let's say the one you have for this month is 60. Don't allow the 60 to finish before you get your next pack, okay, because most of the time these drugs are quite scarce. So let's say you finish you are still hoping that you have 20. Probably when it's remaining 5, you now start going to, to where you get your supply to buy another one from. And by the time you go there, they'll tell you it's out of stock. So you have to start waiting. Remember, the more you waste time, the more your kidneys, the new transplanted kidneys, can start desensitization. The little hours left that you did not take those drugs can happen a lot, that you may not know at that point. Your kidney will not fail, but there's been a memory created on that new kidney that this is not yours. So over time, and then you still miss another one, probably 2 hours after, the memory is being created. When it will now fail, it will just fail. Okay, there will be a lot of cascade of so many things that will go on and then make the kidney to fail. So please try to get extra stock of those medication. Don't allow your transplant medication to finish before you get another one. The one for this month, before it finishes, get another one and keep it in stock, because this thing can always go out of stock, right? Okay, so there is this thing that people that have are transplanted they do. When we say go back to your normal life after kidney transplant, it doesn't mean go back to your normal life, right? We say after kidney transplant, go back to your normal life. It doesn't actually mean go back to your normal life. You can go to your normal life means, like, of course, you come to dialysis 3 times in a week or 2 times in a week. Of course, you won't come to dialysis again. Of course, there are some things you don't eat. Like, for instance, your dialysis, I will tell you to, not to eat some certain things, like you're the person that likes oranges, or some certain things you actually like that will ask you to stop. No, you can eat some of those things, but be careful. Now, you have to, as much as you can, try to limit your salt intake. Even when you don't have kidney transplant, you just have to limit your salt intake. So if you've transplanted kidney, try as much as you can to limit your salt intake. Low fat diet. You can eat the good protective kind of fat, the fat that is good for the kidneys and for your heart. Okay, like I've mentioned this before, this kind of sardines, not the canned sardine. Okay, omega-3, food that are rich in omega-3. Please try as much as you can to reduce your sugary drinks, those beverages, foods that are fruits that are highly caffeinated. Try as much as you can to reduce them. Okay, and please go back to working out. Try to exercise, especially because of that drugs, those immunosuppressant drugs, because these immunosuppressant drugs can increase your chances of having diabetes. So when you work out, it helps them dematerialize. So you at least work out at least 3 times in a week, and please let your doctor know before you engage in any working out. Okay, so the next thing you have to do is please make sure that you visit your doctor, right? Make sure all the appointments you have scheduled with your health person, your physician. Please try as much as you can to visit your doctor. Go to your doctor. Do not miss that. Okay, now, very important, there are some vaccines that you should not take if you have kidney transplants. Please, very, very important. There are some vaccines, of course, you can take your vaccines, but there are some vaccines that you should not take if you have kidney transplant, because you're already on immunosuppressant, so your immune system is already low. So you have to be very careful on some vaccines, and these vaccines are live vaccine. Any vaccine that is live attenuated vaccine, please do not take it. For instance, hepatitis B vaccine, of course, should be given to you before you do your transplant. But measles vaccine, mumps vaccine, rubella vaccine, chickenpox vaccine, yellow fever vaccine, even the flu vaccine, please don't take these vaccines. Okay, please avoid them because they can make you very very sick and they can affect you in certain ways. Okay, the vaccine you can actually take, the vaccine you can actually take, you can take hepatitis A vaccine, especially if you're traveling out of the country. You can take typhoid vaccine, you can take COVID vaccine. These are very very important for you to take. Please, uh, we've told you to, in as much as you can, to avoid infection by any means necessary. Okay, avoid infections and try as much as you can to, in as much as you're not taking those vaccines that I mentioned, those live vaccines, please don't stay close to anyone that has taken those vaccines. For instance, your baby may take oral, yeah, oral polio vaccine, the one they put in the mouth, or some other kind of vaccines. Please make sure you avoid those people that are taking any kind of vaccine, because this will really 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 help you. Okay, I made mention of this on the video I just made some minutes ago. I think I posted on Instagram. Someone was asking, how should can I get pregnant immediately after um can I get pregnant immediately after transplant? Well, you will not get pregnant immediately after transplant. Please, you can get pregnant. Yeah, if you want to get, some people that did not giving birth, so they're asking if they can, they have chances of giving birth. Of course, you can give birth, but please make sure that you don't give birth. Give 1 year space before you give birth. Number one. 1 year space before you give it. Make sure that your kidney results, your kidney investigation have been optimal for a very long time, like it's not shaky. Okay, then please let your transplant team know about this. There are some drugs that you are on that may affect your baby, so please let your doctor know so that your doctor can replace those drugs or change those drugs for you. Okay, and make sure that high risk doctor, obstetrician is interested with your care. Okay, uh okay, so it is also very important to know that you have to take plenty of fluids. Okay, drink a lot of water, please. That reminds me, we'll be having a live on Instagram, I think on the 23rd of this month. We'll be talking about how much fluid you should take in a day and how important these fluids are for your health. Okay. So guys, because people are not coming in, I think I should go to my Facebook. So if you're coming now, please try to join us on Facebook, because a lot of people are asking me to come there, that they have a lot of questions for me. So this one is just for kidney transplant care. On our next video, we'll be talking about blood pressure management care, and then of course kidney stone. Have a nice